fake science versus science. Be cautious. When people, including experts, describe science, they usually mean medical science, which is a non-existent or imaginary thing like viruses, but imply they are referring to actual science, chemistry, physics, and mathematics, mainly chemistry. Generally, they cannot talk directly about the actual science because they have not studied or practiced it significantly. In most cases, they lack understanding, even at the basic level. So, when reading articles and comments about science from such expert or their research, make sure to know which science is referred to, the fake one, like medicine, virology, etc., or the actual one. There is hardly any critique from knowledgeable people about the well-established and well-understood principles and practices of the actual science. Viruses, variants, PCR testing, sequencing, RNA, mRNA, spike protein, vaccines, gain-of-function research, etc., are all fake science inventions. They can only be resolved, and quickly, by applying the well-understood and well-established principles and techniques of actual science. Fake science and its promoters are confusing and hindering resolving the issues. Be cautious and seek help from actual science experts or scientists. My training and expertise. People ask. Many times people ask me how it is that I provided convincing arguments against the existence of the virus, invalid, PCR, antigen, etc., testing, fake pandemic, and failed vaccine developments. I made the predictions accurately early in the pandemic without being a medical expert. Further, why do others with similar academic backgrounds, i.e., having chemistry expertise, not speak out or make such a convincing case? The reason is that what medical and biological experts describe, testing, isolation, RNA, proteins, pharmaceutical or vaccine development, are chemistry topics, not medical ones. Hence, their claims are mostly scientifically incorrect and invalid. The subject, my specialty, is analytical chemistry, a subdiscipline of the main subject. Most often, for main subdisciplines of chemistry are taught at undergraduate levels. They are organic, inorganic, physical, and biochemistry. Analytical chemistry is a separate subclass that comes later and may be considered a specialization. Often biochemistry is considered chemistry in medical or biological areas. However, unfortunately, biochemistry generally does not deal with the topics mentioned, hence cannot address the issues. It is more like part of the practice of medicine. Not many study analytical chemistry in greater depth, but use it as part of their subject. However, I happen to have studied this in detail. My M.Sc. and PhD theses were in analytical chemistry. Further, being part of Health Canada, 30 years, I had to study several medical-related subjects such as pharmaceuticals, physiology, pharmacology, toxicology, statistics, clinical trials, and regulatory requirements and standards. This unique combination of training and expertise helps me see things from different perspectives, which is hard to see if one studies only the medical or chemistry, science, area. It also helps me write clearly, which would be difficult if one is unaware of this needed combination. So, if anyone wants a second and scientifically valid opinion about viruses and virology, particularly medicines, chemicals, look for a trained analytical chemist with strong medical and biological knowledge.